So it's been a little while since I've given you an update in terms of guidance if you're pregnant during this coronavirus pandemic, and that's because there's actually been a period of waiting to see some new evidence emerge and also see how on the NHS we've been able to respond to this crisis. But this is actually a really good time to go through some things which have hit the headlines, have hit the news, and also with regards to some new updates from the Royal College of Obstetricians and Gynecologists. So first of all, regarding new evidence that's come through, we haven't had anything categorical yet, but one update is that we have had a report from Wuhan in China, whereby a mother diagnosed with coronavirus also gave birth to a baby who tested positive for coronavirus. Now, at the moment, this could potentially mean that there is some vertical transmission either through the placenta or amniotic fluid, but we're absolutely not sure about it yet, and we definitely need more research and further evidence in order to be able to guide and influence, new measures that we put in place. So for the time being, we're still reassured that there isn't direct vertical transmission from mother to baby as far as we can tell. When it comes to breastfeeding, we still feel that this is safe. There isn't a single case that's been found where breast milk has tested positive for coronavirus, so this is really reassuring, and we very much want to encourage new mothers who want to breastfeed to do this, because it's important that some of these antibodies are passed on to the baby. So that's something that we feel passionate about getting across to women, but also the fact that even if you are diagnosed with coronavirus, we don't want to separate you from your baby, because actually the time that you spend bonding has been shown in many studies to help influence your child's behaviour later on in life. So it helps with learning skills, with social skills, as well as managing stress. And plus, it's been shown to help reduce the chance of postnatal depression. So it's something we really want to encourage. But of course, it's important that you take precautions if you are diagnosed with coronavirus or have symptoms suggesting coronavirus. And so, for example, if you're coughing or sneezing, you wear a mask and you try not to cough directly on your baby. If you wash your hands before and after handling baby. If you're expressing and using equipment to help you to feed baby, that this is washed and sterilized appropriately. So little things like that just to help you. We are doing this slightly different compared to some other countries like China and America, who are actually separating mothers who are coronavirus positive from their babies. But we feel that the overwhelming evidence is in favour of actually keeping mothers and babies together. So that's the guidance we're issuing here in the UK. Now let's take the antenatal period of time. So if you are a low risk person who is pregnant, so that means you're under the age of 40, you have no other comorbidities or medical complications, things are going well for you, then you will have some basic antenatal care. You will have a scan at 12 weeks and then at 20 weeks to look for anomalies, and you will also have some midwife-led appointments. There isn't really a reason for you to necessarily see a doctor or a consultant unless there are problems later on. Now, generally speaking, for everyone, the number of appointments that we provide has had to be reduced simply because of the immense burden on the NHS, but also the fact that we really want to minimize the spread of coronavirus, especially within an environment where there's vulnerable pregnant women. So that is why we have had to make some reductions. However, if you are someone who has any complications during the pregnancy, you're 40 years and older, you have other comorbidities or medical conditions, then it's really important for you to be reassured on the fact that you will still have that face-to-face contact with your doctor, with your midwife where appropriate as well. So for example, if you have diabetes or preeclampsia or suffer from a raised blood pressure, then we absolutely do need to monitor you and to see you, and this may involve some more regular scans as well. So rest assured that we will be ensuring with absolute certainty that actually those who are most vulnerable are seen and are protected. So that's something I really want to get across and make sure people feel good about. Now, when it comes to the actual process of labour, there have had to be some cutbacks, as you've probably read and seen in the news and hear me speak about. So one of the biggest things that's come in is if you are in labour, you are allowed one birthing partner, and this is now the case across most trusts in the UK. And for most of us, we're only allowing that partner to come during the active phase of labour. So that's when you're 3 to 4 centimetres, contracting regularly. The reason behind this is that the latent phase can last a couple of days in some instances. So if you are having an induction of labour, sadly, your partner can't be present for that. But when you do reach that active phase of labour, then they can be with you, and we recognise that this is really important. However, there is one catch to this, and that's if your partner becomes unwell, we won't be able to accommodate them on labour ward. So it's really important that you have a contingency plan and you find someone else who could potentially act as your partner should your original partner not be able to come with you. So this is a sort of number one tip in terms of planning ahead for your labour. Now, if you are admitted to the antenatal ward for any reason, or the postnatal ward, sadly, we won't be able to accommodate partners there. Now, make sure you check with your local hospital, but again, this is the case for most trusts at the moment, simply because we have to minimise the spread of coronavirus and also help to protect all of our other patients who are vulnerable, as well as our staff. So this is the reason that we've had to bring these really, really difficult measures in place that no one's wanted to do, but we are being forced to do. This is the other reason why also home births are being prevented and suspended in most areas as well. So with home births, it involves a midwife going out to look after you. But if there is any sort of complication, we can't guarantee that an ambulance will be available for you to bring you into hospital as speedily as possible. The other thing is that if we allow midwives to go out into the community, it potentially exposes them to the coronavirus. And at the moment, because a lot of trusts are facing staff shortages due to self-isolation and the fact we haven't got all the testing in place yet, it means we really need to focus on centralising our pool of maternity staff in one place and ensuring that we keep both mother and baby safe. So this is another reason as to why, if you are diagnosed with coronavirus or you have symptoms of coronavirus, we do need to deliver you on labour ward, and in particular, but actually all cases now, and as we're hearing about, are having to come to labour ward because we haven't got the resources to be able to ensure that women are able to deliver safely in other communities. If you were after a water birth, then again, most trusts have stopped offering this, and this is because there is some evidence that coronavirus can be found in feces, and obviously we don't want to risk that this could potentially infect anyone else who's handling that water, as well as potentially babies. So this is the reason why most trusts have also suspended this as well. So there's a couple of changes, practical changes that we've had to bring about, but the reassuring thing is that, even if you are on labour ward and even if you have got coronavirus or symptoms of coronavirus, there isn't a reason not to allow you to birth naturally unless there are complications during labour, in which case we will have that discussion with you and make a decision as to whether we need to deliver you an alternative way, such as a cesarean section. So rest assured on that. And also we think that Entonox is safe to use, so we will allow you that, as well as having an epidural. So these are things to take some, hopefully, reassurance from, and we will try and obviously follow your plans as much as possible. But I think it's just really, really important for everyone to be open-minded, as guidance on the coronavirus is changing so rapidly, and it's such a dynamic field that all of us are incredibly involved in and staying on top of, and things may change depending on new evidence that we gather. So for now, these are the latest updates that I just wanted to make sure you were aware of, but I will obviously keep you as updated as I possibly can and as things develop from here. So just know that we're absolutely on your side. We want you to have as safe an experience for yourself and your baby as absolutely possible. And please rest assured that we will also absolutely be supporting you in terms of breastfeeding and any counselling that you might need during this very difficult period of time.